Okay, good morning everyone and welcome to this session that we're running this morning for the Gender, Justice and Disaster Inspiring Action Conference. It's wonderful to see you. Today's session is looking specifically at violence against women in disasters, and we're very lucky to have with us today Carla Mcgrady, the author of Changing the Picture, which is the framework for the prevention of violence against First Nations women. Carla works for Our Watch, where she's the manager of emerging practice. And we've also got with us Hayley Foster, the CEO of Women's Safety New South Wales. Thank you both so much for joining us for this panel. We're really looking forward to it. My name's Naomi. I'll be your moderator today. I'm an associate of the GAD-Pod. You'll see in the chat box, if you need any help, you can reach out to our tech support. Please don't hesitate to get in touch with Vanessa Brown or Jas Breach, who can help you. So I just wanted to say good morning to everyone and thanks for joining. I wanted to start by acknowledging the traditional owners of the land on which I am. I'm on Wurundjeri Woi-wurrung land of the Kulin Nations. I pay my respect to the traditional owners of this land, pay my respects to their elders past and present, and to any Aboriginal and Torres Strait Islander people here today, where we've got people joining us from all over the country and internationally. So if you'd like to acknowledge the country that you're on today, please feel free to do so in the chat box. I wanted to introduce to you, we don't have long, so I'm keen to get moving. I want to introduce you to the two keynote speakers. If you'd like more info about their bios, you can read that on our website today. So we're going to hear first today from Carla Mcgrady, and we'll then go to you, Hayley, and then we'll open the floor to questions. I think it's worth noting, as we pay our respects to elders past and present, that the disaster of colonization has been unfolding on this land for more than 200 years. Tony Burt, the acclaimed First Nation historian and writer, has said that the Anthropocene, which is often used to describe the age in which human impact on the environment is changing the very nature of our geology. Tony has often said that the Anthropocene is merely a map in geological time of colonisation, and we've also got many Indigenous academics who point to colonisation as a critical issue in disaster. And we've also got creative contributions from people like Alexis Wright and Kim Scott, who give us powerful accounts of colonial patriarchy unfolding in Australia. Carla's work identified colonial patriarchy as a driver of the disproportionate violence that First Nations women experience. And certainly one of the most terrifying things that I heard coming back from the service system during COVID was that JIRA, the Aboriginal Women's Service in Victoria, was deeply concerned for their clients, not because they saw a fantastic uptick in calls or contacts, but because nobody came in and nobody called for weeks at a time at the start of the disaster. So we're going to hear first from Karla about the framework for preventing violence against First Nations women in Australia, and then we'll move to Hayley, who will give us the latest on impacts of COVID-19 on women's safety and the challenges for victims, survivors, and for the service system. Karla, I wondered if we could start with you, and perhaps you could tell us a bit about how Changing the Picture came into being, and the framework that you developed to prevent violence against First Nations women.
Yes, thank you for that, Naomi. Just also acknowledging I'm on the lands of the Yagara and Turrbal people here in Meanjin, Brisbane, and paying my respects to their elders and ancestors, and also to my own, the Gamilaroi people from northern New South Wales, or what is now known as northern New South Wales. My work with Our Watch started just over 4 years ago. So I joined Our Watch specifically to support the development of Changing the Picture as a resource to speak to violence against Aboriginal and Torres Strait Islander women. Part of that was fairly extensive consultations as well as evidence review, and looking at, you know, what information was already out there, but also coupling that with community perspectives and those people who engage in the sector, but also in the systems that, you know, are there to address these issues for not just Aboriginal women, but all women in Australia. One of the key things that we found throughout the development of this resource was that it's understood that the rates of violence against Aboriginal and Torres Strait Islander women are much higher than they are for women generally across the population here in Australia. What we didn't quite understand or have a piece that spoke to was why specifically that is the case for Aboriginal and Torres Strait Islander women. And so this resource that we developed seek to understand those drivers and what differentiates violence against Aboriginal women from violence against women in general across the population in Australia. What we found was that the intersections of racism and sexism are not fully considered in a document like Change the Story, which Our Watch had developed prior to Changing the Picture. And so this document, Changing the Picture, seeks to look at that more specifically and what is involved in those intersections of sexism and racism, and how do we understand that and what do we do about it. One of the things that came through not only in the evidence review but also throughout community consultations was that issue around racism and Aboriginal women telling us that, you know, being Aboriginal and being a woman, these two things can't be separated, and they need to be considered and understood together at that intersection, and what that means here in this country for us as women when we're talking about the impacts that we face as Aboriginal people, but also as women, and the compounding nature of that, which, as we see, results in those higher rates of violence, higher rates of incarceration of Indigenous women, higher rates of incarceration for Aboriginal people generally. What we have seen is, in recent years particularly, is a spike in the incarceration of Indigenous women. We talk about that in Changing the Picture when we're talking about that overrepresentation in the criminal justice system, and that often racist attitudes and discriminatory practices in these authoritative systems are much to blame for that, because Aboriginal women are never just seen as victims. There's always, the supposition that we are also perpetrators in any sort of framing of our engagement with the criminal justice system in particular. And it's not just the legal and justice systems. We see this replicated through systems like healthcare, education, child protection agencies, and these systems are all intertwined and interlinked. They work together, and we are told that is, you know, for a good reason, that these systems talk to each other. But for Aboriginal people, that's often not the case. The way that these systems speak to each other and refer to each other is often to the detriment of Aboriginal people, and in particular Aboriginal women. We know that a lot of these sort of attitudes and beliefs are very deeply held within Australia as a society, and to, you know, try to work to change those attitudes is very hard work when they are so very deeply ingrained, not in just individual attitudes and beliefs, but within the systems that we also have to engage in. So it's very hard to change the narrative, and quite often what we see is the silencing of the voices of Aboriginal women around these particular issues. And we're often told that, you know, those of us that disagree, particularly with commentary around justice systems, healthcare systems and so forth, there's always some, or, you know, a group of Aboriginal people that actually agree. So the line about us not all singing from the same sheet is often played back to us as a defence for not listening to us. And when I'm talking about us, I'm talking about women who have had these experiences of violence, but also, you know, academics and professionals who work in this space and understand the way that these systems operate, because they've not only done the research, but they've had the experience themselves of engaging within these systems. And so it's important to think about those impacts of colonisation as ongoing, as we talk about in Changing the Picture, and understand that we're not talking about colonisation as an event that occurred some time ago, that this is ongoing. And we've even seen throughout the pandemic that not even a global pandemic can stop colonisation doing what colonisation does. And the far-reaching impacts that has on Indigenous peoples all over the world, and here, you know, particularly in Australia. And it often becomes that these disasters or these events that are seemingly out of control of people are added to the list of excuses or reasons why, you know, new laws or restrictions on the way that Aboriginal people want to determine how they live their lives are enacted. And any pushback against that is seen as not wanting to have a solution to the issue, which, you know, you can talk and, you know, chew gum at the same time. These things are complicated and intertwined, and they have to be thought about in a way that is understood from the perspective of Aboriginal people who have to experience the way that these systems behave and the way that they interact with each other. We've seen that in the level of distrust that Aboriginal people have had with systems, government throughout COVID, not wanting to engage because of that inherent fear of mistrust within systems, which is very well founded, I might add. But it's also this thing around, you know, wanting to take care of ourselves. And we've seen Aboriginal healthcare services in particular, and community organisations and services really step up to the plate and take a lead for Aboriginal people here to, you know, protect us as a people wherever it is that we're situated, whether it's remote communities or within cities. Community controlled organisations have really been key in enacting, you know, those principles around self-determination and community leadership to identify what it is that Aboriginal communities have needed throughout, particularly the last 12 months. And we've seen the results of that, the extremely low numbers of COVID cases for Aboriginal people, when we also know that Aboriginal people are one of the highest risk groups of people, not only for this, but for so many other health-related issues. So we know that these principles that we talk about in Changing the Picture work when Aboriginal people are given the opportunity to take the lead and to speak directly to what it is that they need when systems and governments and so forth that are supposed to be delivering these types of services just aren't quite hitting the mark. And it's Aboriginal people and Aboriginal women who are leading the way on speaking out against that, or speaking up for Aboriginal people. And that's really the model that Changing the Picture speaks to, is, you know, continuing to listen to Aboriginal people, Aboriginal women, when it comes to violence, when it comes to health issues, you know, these systemic issues that where racism and sexism intersect. The key being that we've been down this road and we've been walking it for a very, very long time. We know exactly what we're talking about, and when we talk about threats to us, we know what that looks like because we've experienced them all already.
Yeah, thanks,
yeah.
Carla. Yeah. That line's really going to stick with me. Not even a pandemic is going to stop colonisation doing what colonisation does. Thank you so much. Really great to hear about how the work that you've done on Changing the Picture and creating, documenting that framework, putting it all together. I encourage people to go to the link and have a look. Is, you know, standing the test as COVID unfolds. These principles are still applicable. Thank you. I'm going to flip to Hayley now. Hayley, welcome. Wonderful to have you with us. I know you've been very busy of late. Be great if you want to share your slides and talk to us about the impact of COVID-19 on women's safety, and what you're hearing from the service system.
So much for having us. We really, really appreciate it. I too would like to acknowledge that I am, as well as everybody else, meeting on Aboriginal land, always was, always will be Aboriginal land. Acknowledge the traditional owners and the custodians here on Gadigal country in the Eora Nation, and pay my respects to elders past, present and the new emerging leaders as well. And acknowledge as well and respect all the Aboriginal women that I have the privilege of working alongside in this critical work. So thanks so much. I think it's such a great opening when we're talking about disaster relief and recovery. You know, in the context of gendered violence, it's so fantastic to have that grounded in, you know, the lived experience of Aboriginal and Torres Strait Islander women who really, you know, came to the fore in trying to, you know, band together in their own communities and make sure that first and foremost their communities were supported. And I think you'll see that throughout this presentation around how different communities dealt with the crisis as well. Oh, I'm trying to move this and it doesn't want it. There we are. So I'll just mention who we are. Then I'm going to go through the fact that we do have a national crisis already. Carla's already outlined the disproportionate impacts of that crisis, but we do already have a national crisis prior to COVID. And then I'm just going to go through some of the findings that we had from the frontline domestic and family violence services in New South Wales, the services themselves, but also the women and their children that they support, as well as some recommendations from the frontline for action. Women's Safety New South Wales is a peak body for specialist women's domestic violence services in New South Wales, particularly the women's domestic violence court advocacy services that are there are 27 across the state in 42 locations. We advocate for policy and law reform in the context of domestic, family and sexual violence on behalf of those members. And we also have a survivor advocate program with an extensive list of a group of frontline, those who've have lived experience of violence that have direct input into our policy positions and speak, and we provide platforms for them to speak out. So the current national crisis, I won't go into that. We already know how severe this is, the fact that it is the single biggest preventable driver, contributes to the burden of disease, death, disability and illness in women aged up to 44 years of age. And we know, of course, that disproportionately impacts Aboriginal and Torres Strait Islander women, but also women with disability, culturally and linguistically diverse women, and trans women, and a range of other groups that are marginalised because of those intersections of oppression at play. I won't go into all of the current kind of crisis. We know we have a crisis. When COVID hit, we kept very close ear to the front line of those who are supporting women across New South Wales. Our member services supported over 53,500 women last year experiencing violence, and they're seeing really high volumes of women coming forward for support. I think the key kind of markers for us was that 50% of the respondents to the survey across the state perceived an increase in clients since the outbreak, and 75% of respondents perceived an increase in the complexity of client need. What Carla was talking to around the family violence prevention legal services in Victoria, around there being a bit of a silent drop for the first instance, that was definitely experienced as well, and that was a really big concern. And for those that were going down and supporting women at court, that was really quite concerning because the courts were closed and there were a lot of areas where women couldn't access the services that they would usually access, and so people were falling between the gaps. I think the other thing that the kind of dynamics that played into that is that women who were experiencing violence were very much shifting their focus on supporting family, supporting community, being there for those in their, making sure that everyone had a roof over their heads, had, the income coming through. There was also health concerns of actually going out and reaching help or seeking refuge. So there were a lot of barriers to reaching out and a lot of insecurity at that time, which made it less likely for women to want to reach out. We really did see more so an increase in people coming forward as the restrictions eased, the COVID restrictions eased. So we saw many more reaching out for support at that time, and then telling us of horrendous experiences and escalation of abuse during COVID, where they were sort of locked down with their abuser in many cases and unable to access the regular supports, including community-based supports. And we did a specific survey with our Aboriginal specialist workers across New South Wales that was conducted by our Aboriginal chair. And what that found is that that was the biggest, for them, that the biggest issue was that there was a huge burden on frontline Aboriginal specialist workers because they, a lot of the other community-based supports that Aboriginal women would have otherwise relied upon weren't there, and they weren't able to kind of show up to. And so there was a huge burden on Aboriginal specialists for that case management, which they're not funded for. What else have we got here? So, as you can see, like the escalation of abuse and violence and abuse for the first time, that was a really big concern, and it was something that we saw and was a bit of a litmus test. We were getting that information weekly. We were getting more data from the front line, and specifically from Aboriginal specialist workers, specifically for multicultural workers, specifically for the issues facing women on temporary visas experiencing violence, who were also particularly hard hit. So we were producing stuff every week just by being that conduit to find out from the front line what was going on. Later on, we know that the Australian Institute of Criminology did that survey with 15,000 Australian women and found similar patterns of, violence and abuse escalating or experiencing violence and abuse for the first time, and increased in coercive behaviours. So you'll see there here, 72.5% of the frontline workers identified women prioritising material needs over their own safety. That is probably not surprising to anyone. And I think the other thing that I would suggest about that is that you know, we've seen this before. We've seen it with floods. You know, I know up in the Northern Rivers when I was working in a frontline service there, that we saw, again, everything goes quiet and everybody's kind of just battening down the hatches. And then we see the aftermath after the kind of when things come, you know, the pressure's taken off and everyone's starting to recover. So whether it be floods or fires or a pandemic, we are seeing the same sort of patterns of women sort of deprioritising their own safety for the sake of family and community at that time, and there's a reduction in access to services. So key issues facing services. Our services were they had to, I won't use that dreaded word pivot, as I just said. Services were having to kind of really change what they were doing, and they still had, you know, huge volumes of clients that they had to deal with, but they were having to adapt their services model. And we had to quickly try to, like, how do we make sure that we provide confidential services? How do we make sure that we've got work health and safety requirements, the data, the protection of data, the IT that's needed, you know, all of that happened really quickly. And we were calling governments for that support, that frontline support, to support the front workers to be able to do that, and the organisations to do that. Because some of the organisations, I mean, network are tiny, you know, like tiny services that don't have anything in the bank to be able to kind of draw on. And unfortunately, we didn't get support from the government until after everybody had already done whatever they could darn well do. So it was kind of, we did sort of see the money flowing in New South Wales, for example, from July, but we'd already, like, everybody who needed to adapt their services had already kind of done that, you know, before that. So you can see there the stresses and the strains on frontline staff themselves, who were themselves dealing with COVID and the crisis and kind of calibrating, but also, yeah, the fact that there was an additional need for things like external supervision, and, you know, dealing with complex client needs. You know, everything, it's much more complex, and there's a lot of, particularly in regional areas, there is such a lack of services, that case management, that ongoing support, and that was really really heightened. And I guess what I would say as well is that a lot of those service gaps that we already have in the service system, that we've already been advocating to fill for so long, they just became really apparent. And instead of, you know, when the government sort of said, oh, we'll come and support you and we'll just basically give extra funding, a little bit of extra funding to every service that's already operating, it was like, well, what about the service gaps? What about in those areas that there are no freaking services whatsoever? What are you going to do? Because actually now more than ever, we need those services. So that was kind of a really critical issue. I think in terms of recommendations for action, when we asked feedback from frontline domestic violence specialists, is that a lot of survivors were still not knowing where to access that support and that safety, to know where the services are. And we find this, because we're in it, we kind of find that surprising, because we're like, everyone knows, you know, we can access support, but actually not. And particularly if you're not engaged with community as much and you're kind of isolated, you're not hearing from community where it is you access support. So that was a big thing around trying to get onto the government to promote where to get support, where to get, at least to get that first phone call. It was problematic as well then though, because a lot of it was like, call 100 respect, and then it was like a phone call, you get somebody, and actually, but who's available in my local community, who's local in my local area to support me? And, you know, and of course we're talking right now about Aboriginal and Torres Strait Islander women, who's available, who's a culturally safe and supportive service that I can access. And so we were trying to engage in 100 respect, with 100 respect, to kind of create more streamlined referral pathways, because that was picked up by the frontline saying, you know what, women might be calling 100 respect, but we're not getting those calls, and we're not, you know, it's not coming through to the grassroots level, and women aren't getting support at the local level. And it's because they were basically giving out the number. So 100 respect would give out the number and then say, oh, you call this service, call that service, and putting the burden on people to keep making extra phone calls instead of facilitating a warm referral process. So that's something that we've been working on as a result of that. I think the other issue was around web chat. So 100 Respect does have web chat, but what about local and community-based organisations, like state level, but also region level? What services can we provide online? Because a lot of clients were saying, hey, actually, we don't, you know, like, it's not safe for me to contact, and also it might be in the middle of the night or whatever. And so we're finding a lot of reliance on kind of web-based support, but there wasn't the infrastructure in that. And we were quite, you know, I'm not here to kind of, you know, the government's done a lot of stuff to respond to COVID, which has been great, but we were disappointed that government basically said, no, we're not going to invest in that. It's going to take too long, and, you know, by the time we do it, it's not going to help anybody. So we would have liked to have seen that. The other one there that I'm saying is just talking about co-location of domestic violence services in other, you know, community settings, and making sure that we have those. And I think Carla was talking about the incredibly important role of Aboriginal women's health centres, as well as Aboriginal medical centres as well. Generally, there are very, very few Aboriginal controlled organisations that are adequately funded and that are that are available across local communities, and that is something that is a significant gap. We need to make sure that people have safe places to go to access services in which they feel comfortable and safe and understood. Further here, so in terms of the big service gaps, again, case management, that ongoing support and being able to connect up with services and not have to like navigate all the services yourself and advocate with all the different service systems that Carla's mentioning. It's not just the legal system, like police, courts, it's child protection, it's family law, like navigating all of those services and constantly having to advocate for yourself when you are dealing and coming up against systemic racism and patriarchy, and it's becomes insurmountable for many. And, you know, and worse for some, even more than others. I think that another key area that came up was that we just really do have to address the issues for women on temporary visas experiencing violence. They just literally couldn't access safety because, you know, if they were on a temporary visa class, that they didn't qualify for income support from Centrelink, then it was virtually impossible to get anything beyond the 2 days and then extended 2 days for temporary accommodation. That's not safety, and that's not really a choice to access safety and support. Income and material needs, again, the government have heard a lot of these things, but it was just really slow when we needed that help. We wanted to see an emergency response like what we had seen in a range of other areas where there's been an emergency response where they just come straight in and the next day the money's there. We didn't see that for frontline domestic and family and sexual violence services. You can see there all those other gaps as well. I guess one of the positives that we think that have come out of one of the positives that we've seen that have come out of COVID, you know, at the time I felt like we were all screaming and saying, you know, what about safety? What about women and children's safety during this crisis? We can tell you this is what's happening. Why can't you just prioritise it and inject what's needed at the moment? And why aren't we part of it? You know, we had all this money going to emergency crisis responses, these sort of hubs that were kind of run by the Red Cross and a range of other agencies, and all of this huge amount of donations and you know, funneling them into these other kind of crisis disaster response efforts. But they weren't integrated with local services. They weren't integrated with specialist domestic violence services, with Aboriginal specific and controlled services. They weren't fully integrated, and the funds weren't going to those on the front line that actually have that developed trust and rapport and you know, with women and children who are experiencing violence or anyone who's experienced violence. So there was just that lack of communication, and I think that's been recognised now that we've had the inquiry. It's such a shame. There was so much evidence base already in the past to show that this is what happens in disasters, and this needs to be absolutely integrated in part of the fabric of our disaster relief and recovery efforts. We did not see that now. We're seeing acknowledgement of that, and of course in the budget that's just been announced there are funds there for that as well, but also acknowledgement that in any disaster relief and recovery efforts going forward in our plans, that women's safety, children's safety, family safety needs to be a central component of that. I think that's probably enough from me today.
Interpreting a few of the questions and trying to jam them up together so that we've got a bit of time to answer them. But we're getting questions about that are recognising there are things we can do in prevention and things that we can do in response, and that we need to be thinking into both of those spaces. And we're also getting questions for Karla about how changing the picture can influence emergency planning. So I wondered if I could just come back to each of you, Karla first. Is there, to put you on the spot, is there a strategy that you think would be one powerful way of influencing, and I want to pull on another thread from both of you, which is that importance of the local or localised context and a response in the local or localised context. So is there one or two strategies that come to mind for you that we can focus on or think into as we look to both better prevent violence against women at times of disasters, as well as responding to violence against women at times of disaster? Karla, happy if you want to stick in the prevention space there, as that's your expertise. That was a really long question. Good luck.
Well, the answer's pretty straightforward, even though it sounds like a fairly complicated question, but whether it's during times of disaster or not, the solutions are not only listening to what Aboriginal women are saying, but actually doing the thing that they're telling you needs to be done. Because that's always been where the solutions lie, with Aboriginal people, Aboriginal leaders who understand fundamentally what this means for our people, because we aren't just representatives of our communities, we are our communities. So the responses that we're talking about that are necessary are as much for us and our families as they are for all of our communities. And we also know that what we do to benefit Aboriginal people benefits everybody and is better for everybody. So the solutions that you work out for those who are most impacted, and to address those solutions, there are flow-on effects for everybody else for that too. If the solutions are there for those who are most at risk and most impacted, and those solutions are enacted, then there's benefits for everybody. Everybody wins in that scenario.
Yeah, thank you. Answered beautifully. Hayley?
Yeah, 100%. Everything that Karla's saying. I think I don't have a lot to add except to say, at the local level, like it's kind of a no-brainer in the sense that at the local, like it was such a top-down response. It felt like such a top-down response. It was like, we're just going to make some decisions at this level, and we're going to get these other agencies that are going to come in and deal with it. But imagine what would have happened if they had have actually gone to those communities, resourced those communities, those interagency networks that happen at the local level, that everybody's already talking together, they're already the experts, they know their community. Imagine if they had have invested in those communities, and I mean, made sure that they actually got the money distributed to the local level with those agencies that have that relationship and have that local knowledge and have, you know, the trust of the community. Imagine what that would have looked like, and it's not that freaking hard. We already know who those community interagency groups, we already know who those leaders are in the community. It's not that hard. And so I think if you want to get good policy, give it to the experts, give it to those who have got those relationships and ongoing understanding, and make sure they're in the room for decision making. So I think, like, ultimately at the local level, how we dealt with disaster recovery at the local level, there should have been all the local leaders in those service sectors should have been in the room devising how we're going to deal with this at the local level. And then there also, of course, there's strategy and there's policy and there are announcements that we have to make at the state and, you know, decisions we have to make at the state and federal levels. Make sure that those local communities and those representatives of the local communities are actually in the room for those decisions too. It's not that hard. And so I guess that would probably be my take home, is that those communities are already there. They're dealing with crises every day. They're dealing with crises that hit communities from time to time. They know this stuff. They know exactly what the priority is. They need to have more agency to be able to make those decisions.
Thanks, Hayley. I think those two answers are almost encapsulated in the last question. We're really at the end of our session today in terms of time. So I just want to say thank you so much to both of you. Really appreciate you coming along and giving us the benefit of your knowledge and insight. I know that each organisation that you represent has resources that are really useful for thinking about and thinking into both responding to violence against women during disasters and emergencies, as well as preventing that violence. So I encourage our audience to go there. Thanks very much for everybody who attended today. I'm just going to let everyone know that we'll be going dark on the session in about 2 minutes, so that everybody gets 5 minutes break between now and the next session. But if everybody would like to join me in the chat in just thanking Karla and Hayley for their contributions today, we will see you back here in 5 minutes for the start of the next session. Thanks so much to each of you.
Thank you. Thanks so much for having us.